Welcome to my YouTube channel. This is my very first YouTube channel, so yay. I wanted my first video to be about my actual, not the ones that I posted before, to be about giving you guys advice as to what causes bleeding, mostly at work. By the way, I'm a registered nurse, so the information that I'm giving is at my level. I am not a doctor. I just want to clarify that. I work at a primary health care level, so we do like diagnosis and stuff like that at a clinical level, at a primary level. So our job is to prevent and cure also, and treat. So okay, so bleeding after giving birth can be caused by a lot of things, but I'm only going to mention two right now. There are certain things that you can see, there are certain things that you cannot see. So now it can be that you've had a miscarriage, or you've given birth, but the clots were not removed properly when you are delivering your child. Or it can be due to the fact that, as I said, some things you can see, some things you cannot see, actually smell. So as for smell, I'm talking about your PV discharge. Actually, you can see your PV discharge. The color changes, the smell, does it change? Is it foul odors, or is it like a yellow discharge or greenish before you go into your periods? So now this also applies to people who haven't had birth, who haven't given birth. Okay, so the part where you cannot see depends on the type of contraceptives that you're using. Sometimes it can happen that you're using contraceptives, but they do not correspond with your body. So we human beings, right? So we all have different reactions to different types of medication. So at times the bleeding can start after you've had maybe 7 days, you've had your injectables or your oral contraceptives. Here in South Africa, our oral our oral family planning drugs or contraceptives, Trifazole, Femoral, Nodets, I can mention a whole lot of them. And then with your injectables, Depo-Provera and Naristarate. Then there's your IUCDs, which are your intrauterine contraceptive devices, and there's your Implanion, which is the one that you insert on your arm. So I'm not going to go deep into those things, but I just want to show you guys that there are certain things that you can see using your obviously using your eyes. Okay, so okay, so now let's say you've had a foul discharge, or your discharge wasn't that. Okay, it was yellowish, or it was it was yellowish, or it was greenish in color, or it had a foul smell before you went on your periods. And your periods, most of the time, we differ. Some of us go through our periods 7 days, some of us 3 days, some of us 2, some of us 5 days. So now you're having your periods for a week, when usually, I'm giving an example, it usually is 2 days or 3 days max. So now it's a week or maybe 2 weeks, and you notice that this is now persistent. After the periods, the discharge begins again. So that is a problem that actually, those are two problems. So with those two problems, you should firstly check your urine. We check your urine at the clinic or at your private doctor or wherever, to see if there are any signs of leukocytes. Those would indicate that you have a urinary tract infection and so forth. And we also do a physical examination to see if your discharge is foul and all those things. So once we find out what's okay, fine, or maybe you're bleeding at that time, so obviously your discharge won't be foul because it'll be bleeding most of the time. So what happens is when your body sees that there's something that is wrong, or there's something that is present within your body that is not supposed to be there, your body tries by all means to get rid of it. The same way as you would react when a stranger walks into your house and you don't know that person. Obviously you would scream or do whatever, or react, whatever. So that's what your body does. It reacts. It tries to get rid of that thing. So as it tries to get rid of that unwelcome fella as I might say, in your body, you then start to bleed persistently, because now it's trying to get rid of it, and it happens consistently. So when it's that problem, you need to solve the pivot discharge, and the protocol here is we give you like injectables, and we give you an injection and antibiotics, and then we also stop the bleeding using the contraceptives that I was mentioning before, which is your Nodet. But then you only take the white pills, not the red ones. They stop the bleeding. Once the bleeding stops, then you stop taking the pills. So it's the oral contraceptives. It's ibuprofen for the pain and to stop the bleeding, and also you get your injections for the infection and so forth. So once that stops, then you also like tell your partner, hey, listen, I had like this kind of a problem, I went to the clinic, they told me this, and this helped me. Okay, that was the first part, the part where you can see these things. The part when you can't see these things, it's the actually I forgot the other one. It's the clots. So once you've given birth, or maybe you've had like a miscarriage and you've given birth, and then there's this clot, like maybe home delivery or whatever, I don't know. But once that happens and you are not clean properly, like I said before, the body tries by all means to get rid of whatever that's in there to come out. Okay, that's when the bleeding starts. And then okay, so what then you need is to go to the clinic or the hospital, or you get a referral or wherever, or you go to the doctor and they clean you properly. Okay, the third thing I was talking about, so yeah, I told you guys about the oral contraceptives and the injectables. So let's say you're starting with your injectables, right? And then you notice that IBO, okay, sorry, the IBO is it's like O but in Zulu. Okay, so then you notice that sorry, okay, then you notice, okay, I've just my periods are not stopping since I started this injection. So what you need to do, because you can't like remove the injection there from your body, so what it needs to happen is you need to go to the clinic, explain to them what's happening, then somebody will help you. But what I know is the bleeding won't stop there and there, unless if you get the pills that I was mentioning to you guys, the oral contraceptives, which will stop the bleeding, and the ibuprofen. And then when you're supposed to get your next injection, maybe after 3 months, 2 months, then you explain your problem again, and then they change you to another one that is good for you. So yeah, I hope you guys enjoyed my video and you guys subscribe. Thank you. Bye.